Imagine the dread of realizing you might be missing out on crucial health information, a feeling akin to being left out of a vital conversation about your own well-being. It's a chilling thought that whispers of potential problems left unchecked, of opportunities for early intervention slipping through your fingers. This is the unsettling reality for many who aren't aware of the subtle yet critical signals their bodies might be sending about colon cancer. This powerful disease, while often silent in its early stages, can be devastating if not detected and addressed promptly. However, the good news is that knowledge is your greatest ally. By understanding the 8 most common warning signs, you empower yourself to take proactive steps, ensuring that any potential issues are identified and treated when they are most manageable, dramatically increasing your chances of a full and healthy life. Understanding the procedure, a deep dive into colonoscopy. A colonoscopy is a remarkably insightful medical examination designed to give your doctor a clear, inside view of your colon and rectum. Think of it as a sophisticated internal inspection, meticulously searching for any anomalies that could signify problems like inflammation, bleeding, ulcers, or the more serious threats of polyps and tumors. The star of this procedure is the colonoscope itself, a marvel of modern medical technology. It's a slender, incredibly flexible tube equipped with a bright light and a high-definition video camera at its tip. This ingenious device is gently introduced through the anus, then carefully navigated through the rectum and all the way up the intricate curves of the colon, reaching as far as the cecum, the beginning of the large intestine. In most cases, the colonoscope is even capable of reaching the very end of the small intestine, a region known as the terminal ileum, providing an even more comprehensive view. The advanced video camera positioned at the front of the colonoscope transmits real-time images to a computer monitor, allowing your doctor to meticulously examine the delicate lining of your colon. This tip also houses a powerful light source to illuminate the path, a channel for irrigating with water or air to clear away any debris or stool for a crystal clear view, and a crucial instrument channel. This irrigation channel is a vital component, flushing water or air into the colon to meticulously cleanse the passage, ensuring nothing obscures the doctor's ability to spot even the smallest abnormalities, especially polyps, which are small growths that can potentially develop into cancer. The process of examination and intervention. During the colonoscopy, your doctor employs specialized tools that can be precisely passed through the colonoscope's instrument channel. These tools, which might include tiny forceps, precise wired loops, or specialized snares, are used to expertly remove any identified polyps. Furthermore, they are used to collect small tissue samples, known as biopsies, from any suspicious areas. These biopsies are then sent to a laboratory for microscopic examination, where pathologists meticulously search for any signs of cancerous cells. A typical colonoscopy procedure is quite efficient, usually lasting between 30 to 60 minutes. It's performed in the comfortable and controlled environment of a hospital or clinic by a highly trained medical specialist, typically a gastroenterologist. To ensure your comfort and relaxation throughout the procedure, you'll be offered a sedative. You'll be positioned on your side, and your doctor will then begin the careful insertion of the colonoscope into your rectum, steadily advancing it through the colon to its furthest reaches. The remarkable flexibility of the colonoscope allows your doctor to expertly maneuver it around the natural bends and turns of your colon. At times, your doctor might gently apply pressure to your abdomen or request that you shift your position slightly, all to facilitate the smooth passage of the scope and improve visualization. Throughout the entire examination, a magnified, high-definition video feed from the colonoscope is continuously displayed on a monitor, providing your doctor with a live, detailed view of the colon's internal lining. This visual data is often recorded, and photographs are taken of any notable findings. To further enhance visibility, a small amount of air may be gently introduced into your colon, causing it to gently expand. While this expansion might lead to a sensation of pressure or mild cramping, it significantly aids in achieving a clearer view. Practicing slow, deep breaths can effectively alleviate any discomfort associated with this. Once the examination is complete, the colonoscope is slowly and carefully withdrawn, with your doctor continuing to meticulously examine the bowel lining on the way out. If polyps or any suspicious lesions are detected during the colonoscopy, they are typically removed on the spot. Small tissue samples are also taken from these areas for further analysis to check for any signs of cancer. The removal of polyps is a crucial preventive measure because while most polyps are benign, they do possess the potential to transform into cancerous growths over time. They are removed using biopsy tools or wire loops passed through the scope. A common and highly effective removal technique is called snare polypectomy, where a wire loop precisely encircles the polyp and a mild electric current is then used to safely detach it. The removed polyp is then carefully collected through the instrument channel for subsequent examination. Other specialized techniques are available, tailored to the specific size and shape of the polyp. Importantly, polyps do not contain nerve endings, so their removal is a painless process. Recovery and post-procedure care. Following your colonoscopy, you'll be taken to a recovery room to rest and allow the effects of the sedative to gradually wear off. You might experience some temporary gas or mild cramping, but these sensations are usually short-lived and will pass quickly. Because the sedative will impair your judgment and coordination, it is absolutely essential that you have a trusted family member or close friend available to drive you home. It's also highly recommended that you take the remainder of the day off from work and avoid making any strenuous plans for at least the next 24 hours to allow your body to fully recover. Before you are discharged, your doctor will take the time to discuss the results of your colonoscopy with you, providing clear and understandable explanations of their findings. Recognizing the warning signs, your body's crucial signals. Now, let's delve into the crucial 8 most common warning signs that could indicate colon cancer. While it's one of the most prevalent cancers globally and often begins its insidious development without obvious symptoms, your body can still provide valuable clues. These signs might initially appear subtle or even unrelated to any serious issue, but recognizing them early can be a game changer for your health. When colon cancer is identified, in its nascent stages, it is remarkably treatable, and survival rates skyrocket. Therefore, understanding these signals and acting upon them is not just important. It's critical for safeguarding your well-being. In this discussion, we will uncover these 8 primary indicators. It's vital to remember that experiencing one or more of these symptoms doesn't automatically confirm a cancer diagnosis. However, they are undeniably your body's way of communicating that something is amiss and warrants professional medical evaluation. A change in your bowel habits, the first signal. One of the earliest and most frequently observed signs of colon cancer is a noticeable alteration in your typical bowel habits. This can manifest in various ways. You might experience diarrhea that persists for an unusually long period, or conversely, constipation that doesn't respond to usual remedies. A sudden change in the consistency or shape of your stool, such as stools becoming noticeably narrower, can also be indicative of a problem. These changes can be caused by a tumor obstructing or narrowing the colon, hindering the normal passage of stool. While occasional irregularities in bowel movements can occur due to dietary shifts or stress, any persistent changes that last for more than a few weeks should be taken very seriously and investigated by a healthcare professional. Blood in your stool, a clear red flag. Seeing blood in your stool is always a cause for immediate concern and should be treated as a red flag. This blood can appear in different forms. It might be bright red streaks indicating fresh bleeding, or it could be darker, tar-like stools known as melena, which suggest older blood from higher up in the digestive tract. Tumors within the colon can bleed, making blood in the stool a potential sign of colon cancer. It's important to acknowledge that other conditions, such as hemorrhoids or anal fissures, can also cause rectal bleeding. However, it is never advisable to assume it's something minor. Only a qualified healthcare provider can accurately determine the underlying cause of any rectal bleeding. Persistent abdominal pain or cramping, a sign of internal distress. Another symptom that warrants careful attention is persistent abdominal pain or cramping. This discomfort might be perceived as bloating, an accumulation of gas, or a more constant ache in the stomach region. As a tumor grows, it can begin to obstruct the colon, leading to pain or cramping as your digestive system struggles to move stool past the blockage. If abdominal pain becomes frequent, severe, or does not resolve with common treatments, it is essential to seek prompt medical attention. Unexplained weight loss, a disturbing indicator. A sudden and unintentional drop in weight can be a particularly alarming sign of colon cancer. Cancer cells are known to consume a significant amount of the body's energy, and the disease itself can interfere with your body's ability to absorb essential nutrients from the food you consume. This type of weight loss is often accompanied by a noticeable lack of appetite and a general feeling of fatigue. While there are numerous reasons why someone might lose weight, experiencing it without any deliberate changes to your diet or exercise routine is a strong signal that something might be seriously wrong internally. Constant fatigue or weakness, the body's cry for help. Feeling constantly tired or weak, a profound exhaustion that sleep doesn't seem to remedy, can also be an indicator of colon cancer. This isn't the typical fatigue that can be overcome with a good night's rest. Rather, it's a deep, persistent weariness that lingers. Colon cancer can lead to anemia, a condition characterized by a low red blood cell count, often due to slow, chronic bleeding within the colon. This bleeding depletes the body's oxygen-rich blood supply, leaving you feeling drained, lightheaded, and struggling to maintain focus. The sensation of incomplete bowel evacuation, a persistent feeling. Do you ever experience the lingering feeling that you still need to have a bowel movement even immediately after finishing one? This sensation, known as tenesmus, can be a sign of a tumor located in the rectum or the lower portion of the colon. A tumor in these areas can obstruct the normal passage of stool, creating the sensation of needing to go even when your bowel is already empty. If this feeling becomes a persistent issue, it's definitely something you should discuss with your doctor. Chronic gas and bloating, more than just indigestion. While occasional gas and bloating are common experiences, if these symptoms become chronic or unusually severe, they could point to a more significant underlying problem. Colon cancer can lead to blockages within the digestive tract, causing gas to become trapped, resulting in bloating and a feeling of fullness, even after consuming only small amounts of food. If these symptoms don't improve or are accompanied by other concerning signs, such as abdominal pain or changes in bowel habits, it's crucial to seek medical advice.